In this video, we are going to discuss regarding the bacterial meningitis or meningitis. First, we are going to discuss regarding the meningitis. So, our topic is meningitis. Meningitis. What is meningitis? Meningitis is inflammation. What? It's inflammation. Inflammation of leptomeninges or meninges to rheumatoid arachnoids. So, like it is this meninges is protective for the brain and spinal cord. Protective for brain and spinal cord, and it's when it's inflamed, that is known as the meningitis. So it is primarily due to the infection. Like what type of infection? So we can classify as bacterial infection, bacterial, viral, fungal, and rarely parasitic. So there is a non-infectious also, or this is an infection or non-infectious also meningitis, like due to the antibodies. So when we classify meningitis, classification of meningitis, in the classification there is bacterial meningitis, then after bacterial there is viral meningitis, then there is tuberculous meningitis, then there is fungal and parasitic meningitis based on infection. Fungal meningitis and there is parasitic meningitis. So when we're moving on the bacterial meningitis, in the bacterial, like it is a most, when we look the bacterial, it is a most severe and life-threatening. So most severe and life-threatening. Then when we look at the common pathogens, so based on the when we classify as this pathogen and the like age, so type of there is a like neonates, then child, then adult, and there is one adult or elderly, and the last one is immunocompromised patient. So when we look at the neonate, in the case of neonate, and like the organism like E. coli subtype Q1, and there is like group B, Streptococcus and Listeria, mainly found in the children. These organisms cause the meningitis in the children, monocytogenes. When focus on the child, so in the child or infant, so there is organism like Haemophilus, Haemophilus influenzae, Haemophilus influenzae, Haemophilus influenzae. Then there is the type of, when we look at the type of the Haemophilus influenzae, so there is type B, and when we discuss other organism like in the who affect the child or infant, so there is Streptococcus pneumoniae, Streptococcus pneumoniae, and when we look other organisms like there is a Neisseria, meningitidis. These are the organisms which cause in the child or infant. When we look at the adult, in the adult there is Streptococcus pneumoniae, and there is other is the Neisseria meningitis. These are cause in the adult. When we look at the immunocompromised, so immunocompromised there is a Listeria monocytogenes. These are organisms which cause these bacteria cause the meningitis. So now moving on the viral meningitis. So in the viral meningitis, this is also known aseptic meningitis, and mostly common in the child due to the immunocompromised most common in the child and some immunocompromised patients only seen. Immunocompromised patient we seen viral meningitis. So there is like a chronic type, like there is a tuberculosis meningitis. So it is mainly caused by the Mycobacterium tuberculosis. So caused by Mycobacterium tuberculosis. And when we look so it is most common when we look the like which type of patient is affected. So most common in the child and also immunocompromised. This type of patients suffer from the tuberculosis meningitis. When we look at the fungal, so it is mostly fungal is mostly common, mostly in immunocompromised, and there is like some organism like which caused by the organisms are Cryptococcus neoformans. So Cryptococcus neoformans and Candida albicans, and after that there is a histoplasma capsulatum, These organism cause these are the fungal. So this is a fungal. So there is a cause that known as fungal meningitis. So when we look at the parasitic, it is the rarest. Initially I have said a rare case. So there is some agent like Neisseria fowleri. It is like primary amoebic meningocephalus. It's caused mainly primary amoebic meningocephalic encephalitis, and there is another organism is the Toxoplasma gondii. these are the parasites which cause the meningitis. So when you look at the pathogenesis of this disease, so initially when there is the entry by the nasal cavity or nasal pharynx, and like when you look at the pathogenesis, so it's like it passes through the nose or the nasopharynx passes through nasopharynx and go into the blood, mix in the blood, and go by the blood. It's go in the CSF, and when it's go in the CFS, so this organism passes cross through the organism cross blood-brain barrier. So there is a blood-brain barrier, blood-brain barrier. So this organism passes through blood-brain barrier, or choroid plexus passes through the blood-brain barrier or choroid plexus. Regarding this choroid plexus, we have discussed in the another video like physiology, where we discussed regarding the ventricle or CSF circulation. So there is a choroid plexus. It helps to the synthesis of the CSF. So by through this there is the infection occur and result of the inflammatory response. So lead to the inflammatory response and lead to the like increased permeability. When inflammatory response is gone, so there is the like there is the increased permeability. Then there is edema, and there is like increased intracranial pressure, increase intracranial pressure, and this all causes some symptoms of the patient. So when you look at the clinical signs and symptoms, moving on the clinical features of the meningitis. So when you look, there is a like fever, infection. So there is a fever. After that, there is like headache due to increased internal cranial pressure, and there is a neck stiffness, and then there is like photophobia, and other symptoms like there is a altered sensorium. Then when you look in the children, especially in the children, there is a seizures in children, and there is two types of the sign is present. One is the corning sign, and another one is the Podolsky sign. These are the some clinical presentation of the patient who are suffering from the meningitis. So when we look like there is the diagnosis. So when we look in the diagnosis, so some parameter like we can take CSF through the lumbar puncture, and lumbar puncture mainly done in the L3, L4 and or L4, L5. So before going to, there is a diagnostic approach, diagnosis. So how we can determine some parameter. So gold standard is the CSF examination. So we are going to in this chart discuss regarding the CSF examination. So in the CSF examination, there is some parameter, and then what is a bacterial, viral, or tuberculous, or fungal. In this parameter we can discuss. So here is the parameter, and here is a bacterial, then viral, then TB, viral. TB is especially chronic cases of fungal, and bacterial is mainly acute measure. So when we look at the CSF in the normal, like there is appearance. So appearance normal is the clear, and after that when we look at the bacterial, in the bacterial case there is a turbid. When we look at the viral is the clear also, and when we look at the in the TB there is the cobweb and cobweb type of appearance. When we look at fungal, in the fungal case there is a clear or the slightly turbid. So this turbid is forming from the like pyogenic bacterial or post-forming bacteria. When we look at the opening pressure, like there is when we check the pressure. So in bacterial there is an increase of pressure, but viral there is a slightly increase or normal or slightly increase. When we look at tuberculosis there is a slightly increase, and when we fungal there is also slightly increase. When cell count, if we discuss regarding the cell count, so in the bacterial there is neutrophil rapidly increases, but in the due to this there is a neutrophil increase in the acute bacterial infection, and when we look in the viral there is a lymphocyte increase, slightly increase or so most of the increased lymphocyte is increased. But in the tuberculosis meningitis, so there is increase of lymphocyte. This is tuberculosis is a chronic disease, so there is not neutrophil increase. When we look there is a lymphocyte increase, but when we look at the normal CSF, in normal CSF there is no neutrophil, but 4 to 5 number of lymphocyte is present, but here is the increasing. And when we look in the fungal there is also lymphocyte is increased, lymphocyte. And when we look the protein, in the case of protein in the bacterial there is an increase the protein, but in the viral normal or slightly increase. But in the tuberculosis there is an increase, and in the fungal there is also increase of the protein. Regarding glucose, it's like 50 gram per deciliter present in the CSF, or more than 15, but 2/3 of what the amount of blood glucose of the 2/3 blood glucose of 2/3 is present in the CSF. So when we look in the bacterial there is a decrease CSF due to the neutrophil, and here is in the bacterial normal glucose, and in the TB there is also slightly decrease due to lymphocyte, and fungal due to slightly decrease. These are the some CSF exams. It is a gold standard. So gold examination or gold standard. Moving on the gram stain. Other diagnostic process is gram stain or acid fast stain, or checking the gram stain, acid fast stain, and Indian ink. So this is gram stain for bacteria, acid fast for tuberculosis, and Indian ink for the bacterial. In the fungal. So when we look at the gram stain, so it's for bacteria, if they are positive for the ZN stain is for the tuberculosis to TB, tuberculosis Mycobacterium tuberculosis is present, and if there is Indian ink for there is Streptococcus neoformans. So after that there is also CSF culture. We can also culture CSF culture. In the CSF culture we can use blood agar, Then chocolate, also use chocolate agar, also Lowenstein Jensen agar, Lowenstein Jensen media, Lowenstein Jensen media, LJ media. It's for the TB, and these are for the bacteria. And Sobrod Streptococcus SDA for Sobrod dextrose agar SDA is for the fungal or fungi. There is antigen detection test. After that we can also check the antigen. So antigen detection test, so we can use in this. There is latex agglutination for Haemophilus influenzae, HIV or HIV. There is Streptococcus pneumoniae. Then there is Neisseria, meningitidis, So other there is also another one diagnostic approach is the like PCR test. In this PCR test, there is a high sensitivity for TB or viral meningitis. It is a high sensitivity. It has a high sensitivity for TB or viral meningitis. And one thing also mentioned, like regarding the culture, there is for the viral, there is like egg or animal culture, so that is not usually the mainly. So now we can move on the like treatment portion. In the meningitis, there is like treatment portion, empirical antibiotic therapy. So in empirical treatment, in the treatment portion, I think it's better to discuss in the pharmacology, but I have discussed is briefly in here. So there is a risk age. What are there is a neonates, then adult, then another is the elderly or immunocompromised. So in the neonate we can give ampicillin with gentamicin, or we can give cefotaxime. And in adult case we can give ceftriaxone with vancomycin as an empirical therapy. And immunocompromised we add for the if there is a case of Listeria coverage, so that we can add ampicillin. There is supportive therapy. So in the supportive therapy we can give IV fluids, antipyretics for controlling fever, and anti-seizure medicine if needed. And in the case of the like pneumococcal meningitis, we especially reduce for the inflammation. We can add steroid like dexamethasone for reduce inflammation. In the case of pneumococcal meningitis. And some prevention, there is like some special vaccination is given, so not I am going to discuss regarding the vaccination. So there is some special organism causing the meningitis. So Neisseria meningitis, like when we discuss regarding this organism and what are the characteristics of this organism. So I am going to briefly discuss regarding this organism, like regarding the Neisseria. Neisseria. What we need to learn? So it is gram negative diplococci, diplococci, and it is a kidney shaped. This is kidney shaped, and it is capsulated. So the capsule is the main virulence factor. Capsulated capsule, its main virulence factor, and it's like it has 13 serogroup. So ABC 13 serotype, and in the 13 serotype mainly A, B, C, D and W, ABCY and W are W135 are the most common. These are the common. And if it is a hemorrhage, if it's caused the adrenal hemorrhage, so there is like Waterhouse Friderichsen syndrome. And when we discuss regarding the another organism like Haemophilus influenzae, so in Haemophilus influenzae, this organism like it is gram negative. Okay, gram negative. Coco bacilli, and its type like when type B is the most invasive or capsulated. When capsulated influenzae or type B is most invasive in nature. And there is like Hamin and F5 and 10 factor needed, 5 and 10 factor for the 10 factor, 10 factor, 5 factor, and required 5 and 10 factor. And this there is like it is vaccine preventable. And when we discuss regarding the Streptococcus pneumoniae, so it is gram positive latent Streptococcus pneumoniae, like gram positive. It is lancet shaped diplococci, and there is alpha hemolytic blood agar, and these are some point.